get started. I'm Dr. Spicher, the medical director here, and I've been asked once again to give an update on the coronavirus epidemic. The last time we did this was in April, and I really thought that that was nearing the end because people were starting to get vaccinated, cases were coming down, and I really thought that that was going to be it. But unfortunately, here we are. So, what I'd like to do today is talk a little bit about where we stand with the pandemic. We'll spend some time talking about Omicron because that has really changed things. And we'll talk a little bit about updates in terms of how COVID is currently being treated. And then we'll spend some time talking about COVID in long-term care communities, including St. Anne's. But before we talk about case numbers and charts and graphs, I wanted just to share a story with you that I think represents what is really happening and something that I hope we don't lose sight of, and that is that all of these statistics that we're going to review today are representative of individual lives and people and families. So this is a story, this is a case of one of my patients from the office. She was 50, early 50s. She had some diabetes, which was very well controlled. She was healthy, she was working full time. I saw her in November for a routine physical, and everything was going well. Her diabetes was well controlled. We talked about the fact that she hadn't had her vaccine yet for COVID, and she was quite hesitant and had a lot of the kinds of reasons why many people have for not getting vaccinated. And we decided to agree to disagree, and I didn't. We left it at that, but I strongly encouraged her to get vaccinated. We got a call a few weeks later in December that she tested positive for COVID, but she was doing well, and we talked to her about the things to watch for. And then a few days before Christmas, we got another call from her that she was very short of breath. And the triage nurse who talked to her on the phone said, we really need to call 911 to get you to the hospital. She said, no, call my husband first. So we called the husband, called 911. And by the time the police and paramedics got to her house, she had already passed. This is a little bit unusual in that most people get to the hospital before this happens, but it's just an example of the fact that the decisions that we make about this disease do have consequences for ourselves and for the people around us. So, it's been said that what we're experiencing now is really an epidemic of the unvaccinated, and in large part, a lot of the burden of the disease is being borne by those folks who have chosen not to be vaccinated, unfortunately. Prior to Omicron, about 80 to 90% of those who were being hospitalized had not been vaccinated. And of the people that get hospitalized, about 10% we would expect may not leave the hospital. And if they require a ventilator and get to the ICU, that number rises to 50%. So those are kind of the numbers that we see locally and nationally in terms of COVID, if it gets to be that severe. So looking at where we stand as a country in terms of cases, you're all aware that recently, with the onset of the Omicron variant, the case numbers have all exploded, and you see that very dramatic line here, and that is still climbing. We haven't reached the peak yet, but I expect it will peak soon. Notice that the number that represents deaths has not done the same thing yet, and we're hoping that it won't. We don't know with certainty if it won't, but it appears that it probably is not going to follow that same steep curve. Pennsylvania mimics really what's happening across the country in terms of the cases. And Lancaster County, much the same. When we look at how we're doing in Lancaster in terms of vaccinations, about 70% of the population over 5 has received at least one vaccine. 60% have been fully vaccinated. And our senior population really is doing well. In Lancaster County, 90% of people over 65 have been fully vaccinated. We're not doing so great with boosters. Only about 36% of the population has had their booster. So let's talk a little bit about variants. You hear the term this variant and that variant, Delta and Omicron variant. So viruses exist to replicate and multiply. And as they do that, as they enter a cell and make copies of themselves and replicate, occasionally errors are made, and we call those mutations. And most times, those mutations don't make a difference, and many times the mutations make it less likely that the virus is going to continue to go on, but occasionally a mutation will come along that gives the virus an advantage. It allows the virus to maybe be more infectious or to replicate quicker. So what we're actually seeing through these variants, we're seeing evolution happening in real time. It's survival of the fittest. So the viruses that end up changing such that they are more able to replicate, that becomes the dominant population. We call those variants. As they change, they can become less responsive to some of the vaccines and monoclonal antibody treatments that we have derived for the virus as it existed at the beginning of the pandemic. And if the virus changes very significantly, we may even at some point have to update our vaccines to account for that. The thing that's important to remember is that regardless of how the virus changes, things like masks and antiviral medications, hand washing, social distancing, all the things that we did before we had vaccines, they still work. So if we look at what has happened in our country with Omicron, every week the CDC does a sampling of the viruses and looks at the different types. So each one of these bars is a week. So since October, it's been all Delta. Delta is the yellow. And starting in around beginning of December, Omicron was first detected, and you see what happened in 1 month's time. Omicron is now over 95% of the viruses that we have that were being typed. So basically, any new COVID case right now is Omicron. It has, in a month's time, from starting in South Africa in November, it was first discovered. First case in the United States was in 1st of December. And already, by Christmas, it's the most common type. And now it's essentially everything. So any COVID case that happens now is essentially the Omicron variant because it is so contagious and it has essentially displaced the Delta variant. So let's talk a little bit more about Omicron and how that has changed things. It appears that it's much more contagious. So, for example, a cloth mask doesn't work as well because it takes fewer viral particles with Omicron. So what's being recommended now is that people wear surgical masks or even N95 masks to get more protection against Omicron because it takes fewer viral particles to make somebody sick. People who've had COVID in the past, they're still susceptible to getting Omicron. People who've been vaccinated in the past are still susceptible to getting Omicron, much more so than with prior variants. So we're seeing a lot more breakthrough cases. hopefully, we believe that Omicron is less likely to cause severe disease. And we hope that there will be fewer people dying and fewer people ending up in the ICU from Omicron. So even though it's more infectious, it doesn't seem to, at least in the studies from South Africa and England, where it has started earlier, it doesn't seem to be landing as many people in the hospital on a percentage basis. So that needs to be sorted out yet. Some of that could be because, a lot of people have been infected or vaccinated, so they're less likely to get severe disease. But it does appear that Omicron causes a different disease. So more likely with Omicron, people will have a sore throat as opposed to a cough or pneumonia. So it appears to be that it's more in the upper airways rather than down into the lungs, where of course it would be much more severe. But what we have to remember is that even if only a small percentage of people get sick, if that is a small percent of a very large number, that's still a lot. And it can still really be a burden for our hospital system. And I can tell you from personal experience that it's a very different environment right now at the hospital. Today there was about 170 COVID patients at LGH. And at the peak of the pandemic last winter, there was 120. So that gives you some idea of the numbers that the hospital systems are dealing with. And we'll see where that goes. So trying to sort out whether Omicron is going to be as severe as Delta. They looked at New York City, and if you take a tracing of the cases and the ICU, so the cases here are in red, the ICU is in yellow, and the deaths are in black. And usually the way past epidemics and surges have worked is that first you get the cases, and then you get the hospitalizations, and then you get the deaths. So it's 2 weeks later they're in the hospital, and then 3 to 4 weeks later they're in the ICU, or they have passed. And so if you superimpose these graphs and shift them by a few weeks, what we're seeing is they're kind of lining up. And so we're hoping that we're not seeing that the deaths and the ICU admissions continue to follow the cases, but the graphs are kind of superimposed at this point. So this is what's happening in New York City. That's like the first area of this country that has experienced a significant amount of Omicron. So we're watching that. In terms of vaccines in Omicron, protection really is only down to about 33% after 2 mRNA vaccines. So that's probably half of what we would have expected with the Delta variant or the earlier variants. So a pretty significant drop in protection from getting disease, from testing positive. Now, it doesn't necessarily mean you're sick. It just means you test positive. It means you have some symptoms. After a booster, there's a pretty significant jump in protection, up to about 75%. So people who have been boosted, we would expect about 75% protection against coming down with any sort of COVID symptoms at all. In terms of hospitalization and severe disease, there's still about 70% protection even without the booster. So vaccines still work against Omicron in terms of keeping people out of the hospital, at least 70%. Much less effective at preventing people from getting minor or less severe illness. In terms of other treatments that we use for COVID, the monoclonal antibody treatments that we administer to people to try to keep them out of the hospital, people who have risk factors and they come down with COVID, they test positive, we want to give them monoclonal antibodies to prevent them from going on to have more severe disease. because those monoclonal antibodies are very specific to the shape of the virus, they don't work very well against Omicron. So the monoclonal antibodies that we have been using no longer work for Omicron. There is one monoclonal antibody that still works, and we'll say a little bit more about that. The antiviral medications, they still work. The treatments that we use in the hospital, they're the same. But unfortunately, the monoclonal antibodies don't work as well for Omicron. So just a refresher in terms of transmission, remember it's coming through the air for the most part. That's why the importance of masks, keeping social distancing. Omicron, it seems, probably has a shorter incubation period and a shorter period of illness. So people tend to be the most infectious right at the onset and even 2 days before the onset of their symptoms. Surfaces we're finding probably are not as important as we thought at the beginning of the pandemic. Mostly it's coming through the air. Another issue that continues to be the same and is probably even a little worse with Omicron is asymptomatic carriage. So people who are perfectly healthy, feeling well, can be carriers and pass it on to other folks, and that's why it's important that even if you're around people who are well, that if they're not from your household and you're getting together, that's important and you're indoors, that you do wear masks. This is probably more likely with Omicron because remember, Omicron now is affecting more people who are vaccinated. And we have found that even people who are vaccinated, who are asymptomatic, can transmit Omicron to others. So again, as before, it's more common among young people. They would tend to be less symptomatic and more likely to spread. Again, just a little bit of review, and these days are a little bit shorter with Omicron, so maybe Omicron might not last a whole week. It might only last 3 or 4 days after onset of symptoms, and the period of infectivity is less. And you've probably noted that the CDC has changed some of the requirements for quarantine. They've shortened them. Some of that is in response to Omicron. I think some of it's also in response to just to keep people from getting back to work sooner. So there's probably 2 reasons why they made those changes. In terms of sort of the natural history of COVID, we've learned quite a bit about this. For most people just experience the first stage and maybe a little bit of the second, and then they get better. So in the first stage, the virus makes you sick, you feel like you have flu-like symptoms, you have fever, you test positive for the virus at this stage, and then if your immune system's working well, you get rid of the virus and you gradually get better, probably sometime around into the 2nd week. There are people who, because of their health conditions, for genetic reasons, maybe because of medications they're taking, they aren't able to clear the virus as well. They start to mount an inflammatory response to the virus. So a lot of inflammation starts to happen, particularly in the lungs. And they start to develop a COVID pneumonia and COVID inflammation in their lungs. And this is when people end up having to go to the hospital. They're coughing, their oxygen levels are low, and so a lot of what we do in the hospital is try to treat the inflammation, more even so than the virus. And for some people, for reasons that we don't fully understand, this inflammation cascade just gets worse and worse and worse. The lungs fill up with fluid, people end up on ventilators, and sometimes it gets to the point where the lungs, even on a ventilator, don't work, and then people pass as a result of their lungs just not being able to be oxygenated anymore. So it follows a pretty set pattern, and we're now able to kind of recognize the stages, and we try to tailor our treatments to the stage that a person is in. But we're certainly not at a point yet where we can rescue everybody. In terms of testing, I think we have a little better understanding of testing at this point as well. Basically two types, the PCR test and the antigen test. The antigen test is very useful in that it's very quick, but it's also useful in that it tells us who's infectious. So if your test is positive with an antigen, that's when you're infectious. And if it's negative, you may still have been exposed, you may still have had COVID, but at least you're not infectious anymore. The PCR test is a much more sensitive test, so it will tell you whether you have had COVID or not. It doesn't tell you whether you're infectious. So someone can have a positive PCR test and a negative antigen. It means they've had COVID, but they're no longer infectious. And then there are antibody tests. Those are tests that detect the presence of antibodies in our blood to the virus. We can find those either from having had the disease or from being vaccinated. Usually takes about 2 weeks for those antibodies to start being detected. Another thing that we're just starting to recognize is what's called long COVID. These are the long-term symptoms from COVID. There's a lot about this that we don't understand. We're just starting to recognize syndromes. Usually happens weeks to months after someone has recovered from the acute phase of COVID. Seems to happen more often in women, and it's actually younger people who tend to have this, average age of about 40. We do know that if you have been vaccinated, your risk of getting a long COVID complication from a COVID infection is about half. So another reason to get vaccinated. This is something we're going to be dealing with for a long time, I'm afraid, as a result of this pandemic. As I mentioned earlier, masks still work. Doesn't matter the variant. They're even more important now in some ways than they were earlier. Unfortunately, they've fallen out of favor with a lot of our population. They've become, in some ways, a political statement, unfortunately, rather than a public health statement. So, again, the importance of masks, particularly with Omicron, and important even after someone has been vaccinated. With regard to vaccines, we're at a much different place than we were the last time I talked to you. Vaccines are now widely available, and we have 3, Pfizer, J&J, and Moderna. The booster has become much more important with the Omicron variant, and we are now actually being able to vaccinate children down to age 5. And they're working on getting a vaccine to work for the age group between 6 months and 5 years of age. So they're still working out the dosing of that. One of the biggest frustrations for me has been just the misinformation that is propagated about vaccination. There's a lot of information that's sort of circulated through social media. And these are some of the things that I hear the most in the office when I talk to my patients. Concern about the vaccine not being safe or not being tested enough. It was, developed quickly because of the pandemic. It turns out that the mRNA technology had actually been in the works for probably 20 years. And they were actually working on it for other vaccines when the COVID pandemic came along. And so it was already fairly well established and well tested. but it hadn't been used yet until this pandemic came along. So the technology is not new. It had been in the works for quite a while. It just had not been used for a vaccine until the pandemic came along. And I think my personal experience and what I read is that these vaccines have been very safe and very effective. So I won't go through all of these different myths and reasons for hesitancy, but this is what is out there, and it makes people hesitant, and we have to keep working at trying to convince people otherwise. What really convinces me are things like this. If we look at the rate of COVID death in this country for the last 9 months, the folks who didn't get vaccinated really suffered during the Delta surge, which happened this last fall. We just got through Delta right here, and you can see the folks that were vaccinated. There's a big discrepancy in terms of who died and who didn't, depending on whether or not you were vaccinated. Currently, about 2/3 of the population is vaccinated fully, and about 88% of seniors in the country. So seniors consistently have done a better job of accepting the vaccine. With regard to pregnancy, we have a lot more information about pregnancy and the vaccine. Initially, there was a lot of concern and hesitancy around whether this was going to be safe for women who were about to get pregnant, or whether if they were pregnant. And that's been looked at quite carefully by the FDA and the CDC, and they're tracking, and following people who were vaccinated and got pregnant, what happened to their pregnancies. And so far, the studies have not turned up any significant difference in whether they're vaccinated versus unvaccinated in terms of fertility rates, in terms of miscarriages, in terms of birth defects. We do know that if you're pregnant and you get COVID, you're at a much higher risk for complications. So your pregnancy is at risk if you get COVID while pregnant. My son is a family practice resident doing his residency this year, and he was telling me recently how they were having a lot of women come in at term with miscarriages, delivering babies who had already died at the time that they presented. And these were folks who had COVID and were unvaccinated. So there seems to be something about clotting and some other issues with COVID and pregnancy that really increases the risk for pregnancy loss. So again, does not appear to be any concern about safety of vaccine, and there is probably significant benefit to being vaccinated if you're pregnant. Same is true of breastfeeding. Studies have shown that women who have been vaccinated can pass along the antibodies that actually protect the baby against getting COVID, who is not yet old enough to get vaccinated. In terms of treatments other than vaccines, this is some bright news. There's 2 new oral antiviral medications that are available now that have been approved for experimental use by the FDA. Unfortunately, it's going to take a while till those are widely available. I don't think Pennsylvania has any of these yet. I think they've gone to other states initially, California, Florida, New York, places where the case rates were higher. But we will be seeing this in the next few months. So there's a drug from Pfizer called Paxlovid, and a drug from Merck. The Pfizer one appears to be the most effective. In terms of monoclonal antibodies, as I mentioned before, unfortunately with Omicron, they're just not very useful. There's only one that is helpful, and we can't get it. There's just not enough of it around. So it's the same issue. So it's frustrating for me to try to call around and see when my patients turn positive for COVID to try to get monoclonal antibodies for them. It's just really hard to come by right now. Vitamin D has been associated, low levels of vitamin D were associated with poor outcomes in studies where they looked at COVID. So the thought was, well, maybe if we give people vitamin D, that'll help improve the outcome. Studies didn't bear that out. So there were studies where we gave lots of vitamin D to people that came in with COVID, and we looked to see, did that improve their outcomes, and it did not. But there's still more research that needs to happen. There's probably very little risk to taking vitamin D, but probably not a lot of benefit either. Same is true of vitamin C and zinc. I hear a lot about this from my patients. You know, I'm on zinc and I'm on vitamin C, and that'll keep me from getting COVID. Studies haven't borne that out. Studies where they actually gave people vitamin C and zinc and a placebo, and they compared how did people do with their COVID courses. Didn't make any difference. It was about the same as placebo. So probably not a lot of benefit there. Another drug that you probably have heard about, ivermectin, an anti-parasite drug used to treat scabies and parasitic infections in people and animals. There were some early studies that appeared to show some benefit. There were laboratory studies where they could demonstrate that in tissue samples, if you gave ivermectin, it would kill the COVID viruses. Unfortunately, the doses that you would need to give are not compatible with life in terms of how many you would have to take. You would get sick from taking the ivermectin to get your levels that high in your tissues. So it's still being studied, and it's not currently recommended. It's not something we use at the hospital, but there is a lot of hype and a lot of press about this, often in social media. In terms of what we do use at the hospital, we use an antiviral medication called remdesivir, and this will work against the Omicron variant because it's an antiviral drug. We use a steroid called dexamethasone to reduce that inflammation in the lung. And this has been shown to make a 20 to 30% difference in terms of reducing mortality. We also use another anti-inflammatory drug that's often used to treat rheumatoid arthritis called baricitinib. And it has been shown to reduce mortality by about 30%. So you need to treat about 20 people in order to see a benefit. So in terms of medications, that's pretty good. It's certainly not a cure, it's not dramatic, but it does make some difference. People get home sooner with that drug. Another question has to do with, I had COVID, does this give me immunity so I don't need to get vaccinated or I don't need to get a booster? It does confer some protection, at least it did with Delta. Now again, Omicron is changing a lot of things, but it seems like if you've had COVID, you probably would not expect to get reinfected at least for 3 to 6 months, so it does give you some protection. Doesn't seem like it's a long-lasting protection, and it's really not as reliable or even as safe as being vaccinated, because remember, by getting a COVID infection, you're risking potential long COVID symptoms or even more severe disease. In terms of boosters, we came to boosters because we realized that after about 6 months or so, the protection that we were seeing early on was starting to fade. So with a booster, we would expect to get that protection back up there again. This is particularly true of the elderly, and it's why it's really important that we get as many of our seniors boosted as possible. A study out of Israel showed a 90% mortality reduction with boosting. In terms of where we stand with COVID in long-term care, So far, recently, we've been spared, but I want us to remember what it was like a year ago. Even though the long-term care community only represents 1% of the population, they accounted for 1/3 of the COVID deaths. And of the entire long-term care population, 10% of that population has died from COVID. So that's not 10% of the deaths, that's 10% of the population. So that's the effect that COVID has had on long-term care. And it's really only been since the advent of the vaccine that things have improved, I think, fairly dramatically. But we can't let down our guard. You know, with Omicron, it is possible that we're going to see cases in long-term care again, and we are seeing that in our community. We are seeing some folks with COVID. In terms of the vaccines in seniors, initially, it seemed like once you got your vaccine, you were golden. You had 90% protection. It was like, you know, like a force field. You know, you were protected. Unfortunately, that has been shown to wane, particularly in seniors who have immune systems who may not be able to maintain that protection as long. So therefore the need for boosters, but boosters have been shown to really make a difference. If we look at, this is the rates of COVID in long-term care, starting in October and going through December in the US. So this top line is residents who have not been vaccinated. The second line is residents who have been fully vaccinated. And this third line are residents who had a booster. So a pretty dramatic difference in terms of rates of COVID in long-term care if you've had a booster. And probably this will be even more dramatic, I think, with Omicron. If we look at what happened to cases and deaths throughout the whole pandemic. Remember back here at the very beginning, cases and deaths were high. This was way back in the spring of 2020. Here was the peak, and this is about where vaccine came, where we started vaccinating seniors in December. And we saw that the rates and the cases came down, but look what happened to deaths in long-term care from COVID since the vaccine. It's a straight line. Even though there have been some bumps with cases going up, the death rate has really not gone up in long-term care. To me, that suggests that the vaccines have really made a difference. And remember how highly vaccinated our senior population is compared to other parts of our population. In terms of our experience here at St. Anne's, it really was at the beginning, it really was last winter where we had the issues with COVID before we had the vaccine. There have been a few people who have been positive since then, but we haven't lost residents since we've been vaccinating. And again, and look at the number of staff. Again, this reflects the positivity around us. We're sort of an island that's surrounded by a lot of COVID right now, and so we really need to be careful. We need to be sure that we're wearing our masks. We need to get as many of our staff vaccinated as possible to decrease the risk of them bringing COVID to St. Anne's. I'm really proud of how well St. Anne's is doing in terms of vaccination. We have 99% of our residents fully vaccinated, 92% of them boosted. I think that's wonderful. We're up to 85% with our staff, and I think that's admirable as well. So if there's anyone out there who still hasn't been vaccinated who's working here, I would certainly encourage you to do so. And I would just wanted to take this time just to recognize the staff and the employees here at St. Anne's in terms of what they have been doing. This has not been easy. People have been going above and beyond. Unfortunately, this pandemic seems like it is not letting up, but we will get through this, we will get to the end of it, but I just wanted to recognize all the hard work and the dedication of the staff here at St. Anne's that has really helped to keep the residents safe. So at this point, I'm going to end the talk, and if you have questions, I'd be happy to entertain them.